Gluteus maximus muscle, it is quite a large muscle in this area. It is rhomboid shape. This muscle takes its origin from the outer sloping area of the dorsal segment of the iliac crest. It also takes its origin from the posterior gluteal line. Upper part of the area behind the posterior gluteal line, we have the gluteal surface of the hip bone. It will also takes its origin from the posterior layer of thoracolumbar fascia. It also takes its origin from sacrum and coccyx. It also takes its origin from the sacrotuberous ligament. Insertion of this muscle, it is in two parts. The upper 1/4 fibers, which has the deep fibers, will be going downwards and gets inserted to the gluteal tuberosity. Rest of the 3/4 muscle, the superficial and deep fibers, will be going down and getting inserted to the iliotibial tract. Nerve supply of gluteus maximus muscle, it is supplied by inferior gluteal nerve. This has branches from ventral branches of ventral rami of L5, S1 and S2. Actions of this gluteus maximus muscle. Whenever this muscle acts, it acts like a chief extensor of the hip joint. Apart from this, it has various other actions like climbing upstairs. Also, it will be helping for cyclical movement. Apart from this, it will be helping for abduction of the thigh. It acts like a lateral rotator of the hip joint. This muscle, as it crosses the knee joint, it provides stability to the knee joint in the form of iliotibial tract. Structures deep to the gluteus maximus muscle. Once we cut the gluteus maximus muscle, there are various structures. We have the muscles, we have the vessels, we have the nerves, we have the bones, we have the joints, we have the ligaments and the bursa. Let us discuss each structure in detail. The muscles which are present are intermediate layer as well as deep layer. If you try to recollect which were the muscles in the intermediate layer, from above downwards, we have the gluteus medius muscle. Below this, we have the key muscle, that is the piriformis. Below this, there is a tricipital tendon. We have the quadratus femoris muscle. Apart from this, we have the origin of hamstring muscles. In between these muscles, if you try to see, there are vessels. The key muscle is the piriformis. In the superior border of the piriformis, we have the superior gluteal vessels. Below the inferior border of the piriformis, we have the inferior gluteal vessels. Entering from the greater sciatic foramina, going towards the lesser sciatic foramina, we have the pudendal vessels. Apart from this, we have the cruciate anastomosis, which is covered by gluteus maximus muscle. We have the nerves. In the superior border of the piriformis, we have the superior gluteal nerve. In the inferior border of the piriformis, from medial to lateral side, we have the nerves. There is the pudendal nerve. Nerve to obturator internus. We have the posterior femoral cutis nerve of thigh. We have the inferior gluteal nerve, nerve to quadratus femoris, and the thickest nerve, the sciatic nerve. Bones which are under cover of gluteus maximus, we have the ilium ischium of the hip bone. We have the upper end of femur along with the trochanter. We also have the sacrum and coccyx. In between the bones, we have the joints. Which are the joints which are coming? We have the hip joint and sacroiliac joint. Covering these joints, supporting it, we have the ligaments. Which are the ligaments which are coming? We have the sacrotuberous ligament and sacrospinous ligament, and the ligaments which are there around the hip joint, which will be covered by gluteus maximus. In between these muscles and the bones, we have the bursas, and in between the muscles also we have the bursas. Which are the bursa which will be coming here? We have the trochanteric bursa, we have the gluteofemoral bursa, occasionally we have ischial bursa. Tensor fascia lata muscle, it takes its origin from the outer slip of the iliac crest in between anterior superior iliac spine and the pubic tubercle. It goes downwards and laterally and gets inserted to the anterior aspect of the iliotibial tract. This muscle is supplied by superior gluteal nerve. Whenever this muscle acts, it will be helping for abduction of the thigh along with medial rotation. Its action on the knee joint will be helping for extension of the knee joint. Gluteus medius muscle, it takes its origin from the gluteal surface of the ilium between middle gluteal line and posterior gluteal line. It goes laterally and gets inserted to the oblique ridge which is present on the lateral surface of the greater trochanter of the femur. This muscle is supplied by superior gluteal nerve. It has a combined action along with gluteus minimus. it will be helping for abduction of the hip joint. Acting from below along with gluteus minimus, this will be helping for preventing sagging of the pelvis on the unsupported side of the pelvis during a time of locomotion. Apart from this, this will be helping for medial rotation of the thigh along with the combined action of gluteus minimus muscle. Gluteus minimus muscle, this muscle takes its origin from gluteal surface between the middle gluteal line and the inferior gluteal line. It goes laterally and gets inserted to the anterior surface of the greater trochanter of the femur. This muscle is supplied by superior gluteal nerve. It is a combined action of gluteus minimus along with gluteus medius. It will be helping for abduction as well as medial rotation of the thigh.